Violent conflicts have been covered since the first days of journalism, but one of the leading experts on this topic says something has changed in the past decade or so. Anthony Feinstein is a professor of psychiatry at the University of Toronto. For more than a decade, he's been leading a study on journalists in war zones.
I think that the big change with journalists is that over the past decade or so, they have now become targets for insurgents, for militants. They are no longer regarded as neutral observers. I mean, if you could capture a journalist for ransom, or if you kill a journalist, it now becomes big news. And I think if you go back over the past 10 years, for me, the watershed moment was the beheading of Daniel Pearl, which basically signaled, I think, to journalists that they were now in the crosshairs, and it's become increasingly dangerous for them as a result. So confronting these grave dangers has introduced all sorts of new psychological risks for them. I mean, war has always been dangerous. There's always been a hazardous profession for journalists, but over the past decade, it's become particularly hazardous because they're now being targeted directly. Well, you know, what you see is this. The group that I've studied is a very experienced group of journalists. They've been doing war reporting for an average 15 years. And when you add up cumulatively the effect of all of this in terms of their mental health, you start seeing that rates of PTSD or depression are actually quite high. They get close to what you would see in combat veterans. And then in this particular group of individuals, you would see that about 20–25% would be using excessive amounts of alcohol, often to self-medicate their distress, or to help with insomnia, or to reduce their anxiety, for things like that.
Dr. Feinstein says most journalists who cover conflicts and wars won't be affected long-term, but some will, especially those working in Syria.
Well, it is quite striking because the data that I've collected, I have ensured that we've used the same kind of assessment tools. So going back 15 years, we've captured the same kind of behavioral data for each of the conflicts that you've mentioned. And what you see in the current Syrian conflict, and here I'm referring to Western journalists working in Syria, is that when you compare their results or their data to data collected from previous conflicts, the Syrian group have significantly more depressive symptoms. And I think this reflects the particular nature of the conflict in Syria, which is extremely dangerous, in which there's really no good side, there's no safe haven. You know, the big news organizations don't have bureaus in Syria, so at the end of the day, a journalist can't take their flak jacket off and put their feet up and relax. They're living amongst the local population who are constantly being shelled or terrorized. So you've got this enormous stress and danger that they're confronting in an unremitting way. And then what the journalists tell me is a sense of hopelessness or futility that they feel with respect to the conflict, that no matter what the risks they take, no matter how good their reporting of the news is, nothing really seems to change. The trauma goes on, and news of atrocity doesn't seem to bring about an end to the atrocity. And that, for some journalists, can be very distressing. So you see that factor as well. And then, of course, there's the newfound risk of kidnap. Suddenly journalists have become high targets for kidnap and ransom, or for worse. So I think it's a confluence of multiple different factors, all clustering together to make this a particularly difficult conflict for journalists to report. And that's showing up in their depression scores. Interestingly enough, if you look at their PTSD, post-traumatic stress disorder scores, say relative to the previous wars in Iraq, or going back further to the Balkans, or earlier in Afghanistan, you don't see too much of a shift. There's a fairly consistent pattern or frequency of symptoms. But when you look at depression, the current group working in Syria are showing significantly more symptoms of depression.